everyone, and thank you for watching this presentation, and I will try to make it as short and as sweet as possible. Dental care is becoming a large part of the aged care sector. It's a large requirement now, and I think it's really important that we all know what is expected of us. We do it each month as part of the Resident of the Day, and I like to really hope and pray that everybody knows what they're looking for. So that's what this is about, just so everybody's on the same page. We all do a wonderful job looking after the dentures of the residents that are cleaned twice a day, and big thank you to everybody that does that. And also for the residents that have their natural teeth, thank you for helping them clean them each day and maintaining them. Right, so now I'm going to show you how to check a resident's teeth. If the resident is able to open their mouth for you, please ask them to do so. Dean, could you please open your mouth? Now, I am going to use my little torchlight just to check Dean's teeth. And we are looking for any broken teeth, any gum disease, where you may see the gum receding away from the teeth, which can be very painful. We're also looking for any broken teeth, and also remember to check the roof of the mouth for any holes or ulcers. We're also going to check the tongue for any coating, and Dean's looks pretty good. If there is a white coating on the tongue, please ask your EN or RN to check it, because it may be a sign that they have oral thrush and require medication, but it has to be a nurse that diagnoses that. So, so like I said, we just check. If the resident has dentures and they're able to remove them for you, please ask them to do so. If not, once again, ask them to open their mouth for you, and just gently, I won't do it to him, slide your finger along the top.
Maybe do it.
Can I do it to you now? Okay. Just slide your finger along the top of the gum and gently release the dentures, trying not to drag them down, and remove them. Same with the bottom. Just gently place your finger in at the side and push it up, and the dentures should come away quite easily. While you're doing that, it also gives you a chance to feel for any lumps on the gums, especially along the inside of the mouth and along the lips, because they can have little tiny ulcers there, and we really need to get onto those as soon as possible. Dean's looks pretty good, so he would get a 10 out of 10. Now, as for the dentures, I have some here. We are going to feel along the denture line for any breaks, chips, sharp edges, which this pair here actually does have very sharp edges. And ensuring the wires are intact, not bent, the teeth are not loose, they are nice and secure, and the dentures are in really good condition and clean. Now, when you're cleaning them, you need to hold them. You don't squeeze them, you just hold them gently in your hand, brush gently, and we are also going to start using soap, not toothpaste, because toothpaste is very abrasive on the dentures, and by scratching the surface of the teeth can actually cause bacteria to build up and cause infection in the mouth and make the resident very sick. So just check. Most of them now should have their names engraved on them. You probably can't see it, but when they're wet, it does show up. So we have practiced engraving on this set. All this information needs to go on the Resident of the Day. You document all your findings if you've discovered any broken teeth. It also pays to talk to the staff that deal with that resident on a continuous basis. They can tell you whether they've noticed changes in their eating habits. Maybe they're chewing their meat but not swallowing it because they can't chew it enough to digest. So it really pays to speak to the other staff members. Okay, now it may seem really simple, but the cleaning of the dentures. Like I said before, we're going to use toothpaste for the residents that have natural teeth, soap for dentures. So, nice soft toothbrush, which should be changed every 3 months. And it is, because they have new denture cups also. Gently apply the soap and just in a nice circular motion. We don't have to rub hard, just ensuring that we're going into all the little crevices. Turn it over. Likewise, circular motion, just the same way as you'd clean your own teeth, but out of the mouth. That's it. And under warm water, not hot water, because that can actually damage the teeth also. And one really good thing to remember, if the dentures are not being worn for a long period of time, please leave them soaking in water. Because if they're left in a drawer or even just in a dry cup, they actually perish. And then if the resident gains their use of them, they're going to be no good to them. So always soak them in water. If it's for a long period of time, change the water every couple of days. So just to keep them nice. And rinse then in a little bit of Listerine or any mouthwash, just to give them a nice minty taste. So, and likewise, if they're cleaning their own teeth, please place a little bit of toothpaste. Doesn't need to be the full length of the head. Pea size, that's all it takes. Now, a lot of residents, when their dentures start to wear down a little bit, they require Polydent or a similar adhesive to help seal their dentures in place. Just got to remember the old simple saying, less is more. Because if you apply too much of this product, you actually do the opposite and you cause the dentures to drop down, which gives them a gap between the dentures and their gums, which can harbour food particles, which can irritate the gums, causing sores or even infection. So we're going to just apply a very small amount. For the tops, all you need is one little piece at the front, one on each side, and just a simple little smear at the top. That is more than enough. Mm-hmm. And for the bottoms, very similar, just a very simple little squeeze at each end. And if they had the teeth all the way round, you would just place a little piece. That way when they press that up into their gum, it is spreading out, and that really does secure the dentures in place, because otherwise you're just defeating the purpose. And nobody likes to do that. The products aren't cheap, so you don't want to waste them if you can really avoid that. And likewise, it makes it a lot easier when you're removing them. You haven't got a pile of glue there acting against you when you're trying to get the teeth out. And please remember, we're going to start using soap only for cleaning, which is really good. We will be using Sterident to soak their teeth once a week. But please remember, if they have wires or any metal attachment on their teeth, cannot be soaked for more than 10 minutes. Because it will actually tarnish the wire and corrode it. So 10 minutes maximum. If a resident likes to sleep with their teeth in, that's fine. 10 to 15 minutes. Always rinse the teeth before giving them to the resident to pop back in. And even after we've cleaned them, really good idea to rinse the teeth in a little bit of mouthwash, just so they've got a really nice fresh taste in their mouth. And if the resident likes to soak their teeth overnight, that's exactly perfect. So there is no problem there. Everybody's doing a great job, but there's always room for improvement. Finally, if you have any concerns regarding your residents' teeth, please speak to your EN or RN on duty. They are more than happy to assist you and give you a second opinion. If the resident requests to see a dentist, mention this to the RN also, and they will speak to their next of kin and organise a visit for you. Look, I really hope you have got something from this. It's been an interesting trial for me. So thank you once again for putting up with me. And if you have any questions, please feel free to ask me.